Good morning, everyone. Welcome to our first Redox Roundtable. My name is Dr. Dick Walker, and I thought it would be interesting for all of you to listen to a group of docs, MDs, sitting around talking about redox and why they're involved with this. And so this is the first time that we're doing this. If you like it, give us some feedback and we'll maybe get together again. But it's March the 19th. Redox Roundtable, and I would like everybody to just sort of introduce themselves and give a little bit of background. I've been a physician for longer than I want to think, well over 30 years. My specialties were internal medicine, emergency medicine, and I kind of got a little broader background when I got a master's degree in preventive medicine and environmental health. And I've been with the CIA for 8 or 9 years or so, and love it. And so most of you know who I am, and then why don't we let ladies go first on the introductions, and then we'll answer a few questions. Maureen?
Hey, thanks, Dick. Thanks for inviting me. I'm Dr. Maureen Hayes. I live in Galveston, Texas. I was board certified in both anesthesiology and pain. Have been a doctor for over 30 years and have pretty much semi-retired. I keep all my licenses up. But mostly have been a redox educator for the last almost 9.5 years. Had a long career in medicine, took kind of a left turn when I realized that medicine didn't have all of the answers, went on to get certified in acupuncture, certified in age management, looking for other things that could help my patients have a better quality of health and better quality of life. And I see I kind of checked all of those boxes for me when I found this. So that's it. Carmen, you want to come on and share?
Sure. Thank you for the invite, Dick. It's good to see familiar faces. So I'm Dr. Carmen Keith. I currently reside in Tyler, Texas, neighbors to Maureen. And very similar to Maureen, I'm board certified in anesthesia and pain. I did my pain fellowship at Harvard at Mass General Hospital. I've been in practice for 13 years, 5 of those in the functional integrative world. My career took a left turn when I had a personal health crisis and was looking for alternatives to help myself. And that landed me in the functional medicine world. I'm an Institute for Functional Medicine certified practitioner as well, currently practicing in that realm. And it's been very, very eye-opening to be able to work with patients who are looking for root cause solutions instead of, some people call it, put icing on my cake and not really help me. So I found ASEA about 4 years ago, do my math, from a colleague. And it's been really incredible to see how it's helped patients. But I also have a very personal story with my father, some of you may be familiar with. So that's me.
Great. Philippe, we'll go north of the border now.
Thank you, Dr. Dick, for this opportunity. And it's wonderful to be with our brothers and sisters in arms here. And I am talking to you from Calgary, Canada. And I am a kind of cross of everything. Dr. Maureen and Dr. Carmen have already depicted part of who I am as well. We have lots in common about that, blending Western medicine and Eastern medicine as well. I am a Western medical doctor from France, formerly a flight surgeon for the French Air Force and space operations. And then I wanted to know in the process about performance, what were the mechanisms behind human performance towards optimizing it and maximizing it in some cases, mostly when you handle challenging or hostile environments and trying to achieve complex operations. So that is my passion. And I met Redox out of a burnout crisis about over a year ago. And that was a revelation in terms of that was the missing link that could explain everything I was doing using stimulations. Because I have to confess, over the past 3.5 decades, I didn't use any drug, prescribe any drug, as I was essentially stimulating the body, dealing what people call the natural principles and laws of physiology and adaptive physiology as well. So, well, for me, physiology is nothing else than anatomy at work. And in an Eastern world, you learn a lot about a bunch of microsystems who are working synergistically, which means all together harmoniously to keep health in a good state and performance as well. And I came to understand that, post-trauma conditions have a lot of in common with aging in terms of mechanism, dysfunctional mechanism, etc. And I have learned that through my career. And my big Tolly book of knowledge was earned on the field, not that much, of course, at the beginning of medical school. We all go through that, but it was so. I was practicing functional medicine decades before the word was coined in the discipline. So I think, like many of us. So it's a pleasure to be here, and well, let's go about Redox.
Thank you, Philippe. Rich.
Yes, hey. I don't have such a great accent as my colleague, but I am bilingual. I lived up north in the States, and now I'm settled permanently in North Carolina. And my background is for over 35 years, traditionally trained doc, founded a family practice, went to undergraduate at Chapel Hill, and then changed one shade of blue to the Duke blue color and went there for medical school and founded a practice. It was traditional based. We didn't do obstetrics. Thank you. I delivered 50 in residency. Don't want 51. And so developed that practice and just wrote traditional medications, taught medical students for a number of years, rose to being the director for the 5-county area for our clerkship position for family medicine clerks in their 3rd year of medical school, and just loved doing what I was doing. But honestly, like most docs, especially primary care, burning the candle. I mean, just less ridiculous hours, honestly. I think about it, 14-hour days, 6 days a week, and then before and after church. It was getting ridiculous. But I just had no time and really no inclination necessarily to look at supplements and what I would call non-pharmaceutical approaches. Really big into lifestyle. I feel that lifestyle is crazy important for all of us. And but I really had no inclination or time really to catch anything else. But then life happens, like life happens to all of us. And life happened for me 4.5 years ago when one of my grandkids landed in a university medical center. And that changed everything, honestly. And maybe we'll talk about that later. But since that time, honestly, it's like the eyes opening up to a whole branch of biochemistry that honestly, when I was back in my training, we didn't know bloody next to nothing. And certainly as a busy doc, I just did not have time to go into the basic sciences all over again. I'm too busy seeing 25 people a day. Really, it's at that point. But this offered me an opportunity to really look at this in depth. And, I'm excited about it. And the last 1.5, 2 years now, I've transitioned my practice to a concierge style practice with MD VIP. And quite honestly, the VIP stands for not what you might think. It stands for value in prevention. And although I did preventive medicine, this has opened the world, because what we traditionally do in my practice now is we're looking at a whole set of markers in terms of overall health that gives us, that those indicators that what may be going on internally. And it's just, inflammation markers. I mean, stuff that I really did not pay attention to. And it's opened a whole new world. And we can talk about that later. I'm excited to be a part of this panel. Thank you so much, Dick, for asking me.
Thank you, Rich. Yeah, I was first introduced mostly because I was getting older and I was looking for ways to slow down the aging process. And I started to see in the literature references to redox biology and how it kind of explained the aging process. And might be something that we could look for in the future to help us slow that process down. And little did I know that there was actually a company out there with a product already, because everything I read said that this was 20 years in the future. And then a friend of mine said, "Oh no, there's a little company out there in Utah that's making a Redox product." And so we both got excited about it, went out and visited, and found that that was indeed true. But I was also looking for a solution to my wife Nancy's problem. She had some really debilitating chronic pain issues and fatigue issues. And here's a gal that used to climb rocks and mountains right alongside of me and was just like devastated with that. And fortunately, ASEA provided the answer for that too. And that was kind of the beginning for me. We didn't have much science 10 years ago, but we had a lot of people who were getting great results. I sat down with everyone I heard about and picked their brain about what was going on, and became really convinced that there was something definitely real here. So, Maureen, how did you first hear about this? Sometimes doctors learn about all their new stuff at a conference or by somebody who comes in the office trying to sell them something, but that's absolutely not the way it usually happens with ASEA. How did you first learn about it?
It's really interesting. I had a friend, my mom was very ill with a life-threatening disease that she had been treated for. They thought she had been cured. It came back with a vengeance. And we live in Texas, not far from MD Anderson, if that rings any bells. And so we had brought my mom to stay with us. And somebody had called me, had heard my mom was sick, and said, "I have something that you need to hear about that could really help your mom." And I call it my period of arrogance and ignorance, because when I saw it and saw that it was made from salt water, I just was like, "Please, I'm a physician. I have this covered. Don't send me this information." I deleted everything. I thought I knew best. I was trying to take my mom to the south of Spain to get, treated at Budwig's clinic, things like that. My mom unfortunately passed away 2 months later. About 6 months after that, I was talking to a friend, most of you know him, Terry Latham, who has a background in computer sales. And he was, excuse me, I'd asked him why he had left this other company whose products that he was using and very successful with. And he said, "I came across something that is truly groundbreaking." And I said, "What is it?" And he said, he told me what it was. I was like, "The saltwater product? Are you kidding me?" And he said, "You know what? I don't know what to tell you, Doc. People are having amazing response to this." What Terry didn't know is my husband, who is also a physician. He's a Harvard doc. I always tease Carmen about that. I trained right down the road, but not at Harvard. I worked for Harvard. But my Harvard doc husband is a pediatric anesthesiologist and stem cell researcher who his claim to fame is his lab grew lungs outside of the body in a bioreactor, transplanted them into pigs. Pretty amazing work. But at that point, he had come back from Iraq, where he was with the military, with a devastating diagnosis. Also went up the road to MD Anderson, was treated there, cured. But he went from being a former athlete, a marathon runner who was still running 8-10 miles a day, when he got diagnosed, to literally being a respiratory cripple. Just opening up the refrigerator door was a huge workout for him. He had to wear oxygen just to watch TV. So our lives had changed significantly. And here comes this product. And, I say it was like an act of God, because I had no faith. I was cynical and skeptical. But for some reason took a look at it. And the first things I saw, because like you said, we had very little information back then. We had studies by Dr. David Neiman from Appalachian State Human Performance Lab that he had done on athletes. But when I saw those studies, I thought, well, my husband is an athlete of sorts. We're talking about respiration. Maybe, what do we have to lose? It's 100% non-toxic. I didn't have any faith that it was going to do anything, but I was incredibly surprised by what happened, and there was really no denying. And then the other thing that actually kind of got my attention, and we'll probably be talking about this, I did go to PubMed and looked for resources there, and there weren't anywhere near what there are now. But what was interesting is I was telling my sister about it, kind of like, this is ridiculous. I've never even heard the terminology redox. And she said, "Well, I have." And I was like, well, how would you have heard of it? She's not a doctor, she's not a nurse, but she is a medical editor at my medical school, the Medical University of South Carolina in Charleston. And they had just received a $10.5 million NIH COBRA grant to study redox in the body, in cardiovascular, neurodegenerative, orthopedics, aging, diabetes, you name it. And, she sent me the press release and I was like, oh my gosh, my sister knows about Redox. Terry Latham, the computer guy, knows about Redox. I'm a physician. I guess I need to learn about Redox. And that's when I started doing a deep dive and actually ordered the product to see what it would do. So thanks, Dick.
Yeah, great sequence there. Really not unusual for people. Most of us kind of stumble into this kicking and screaming. But Carmen, how did you first learn about it? I mean, what was your experience there? Because a lot of people look at this mostly because they're trying to find a solution for somebody that they care about, and they're a doctor, and they everything's been tried, and they throw up their hands and say, I don't know what else to do. And then along comes ASEA kind of knocking at the door in one way or another. How did that sequence work out for you?
Yeah, and I would sum that up by saying, when the student's ready to learn, the teacher appears, right? And so I guess I was ready to learn because it walked in my clinic door in the hands of a colleague who had struggled with some chronic inflammatory discomfort. And she was just like, she brought me this small tube of the gel and said, you've got to look into this, call me later. And so I took a bit longer in my ignorance and arrogance phase, also Maureen, but I really was searching. I was like, redox is basic biochemistry. I remember this. I know this. And so my hesitation really was from the delivery method, from the supplement world, not necessarily from the pharmaceutical world, diving into the history of the company itself. The science is there in the basic science and biochemistry of where I really loved in school. It was, wow, what do you mean? I could apply this biochemistry in its simplest form through this, but it's coming through this avenue. And so that really was my struggle, not necessarily proving the science. And, so I started using it myself. Eventually, I got enough knowledge about the company to trust it. Watching Tyler Norton, every YouTube video, the ethos of the company blew me away. His delivery, his commitment, his vision, and then the story of ASEA with Virtus really grabbed me. And I was like, these are humans who want to help humans. And that means a lot to me. The ethos, the heart really means a lot to me for this. Because in the pharmaceutical world, there's not much of that, right? And in the pharmaceutical world, we can name a few, we could, but we're not going to, snafus where doctors took hook and bait from the pharmaceuticals with their explanations of how drugs work. And we got ourselves in a bit of a problem, not just individually, but nationally. And so for me, it was, let me try this. I immediately had started feeling better in brain fog, clarity. We all make a living with our brains. And so brain function is hugely important. And then, coupled with my curiosity for longevity and, in my head, the common disease that we all share and cannot get away from is aging. And so I look at that from that perspective and say, well, redox at the heart of it could be where the solutions lie. So that's how I got introduced to it. It turned into a wonderful story with my father's health. And then, of course, I trusted it and have faith in it, and have helped many patients who wanted that.
Yeah, not only is this coming to us through the supplement world, even though it has the power and efficacy of more so than many of the pharmaceutical products out there. The other nice thing is it's totally safe, and we don't have to spend 10 minutes talking to patients or give them a 10-page, fine print about all the bad things that can happen, or you see the drug ads on TV. Well, it can cause diarrhea, constipation, yada, yada, yada. All of those things, oh my God. And we don't have to explain any of that, but yeah, and then not just that it's a supplement, but then it comes from a company that's bringing it to us through network marketing. It's like, and yet all of those things are there, and yet we've got a product that works and is just literally saving people's health and lives. So Philippe, who first told you about it? I think it was maybe a colleague from your astronaut or space age side of your life, wasn't it?
True. Thank you, Dick. I am very moved by my Sisters in Arms experience here, because I have experienced very similar things on the way that I began to be a needy before understanding the value in terms of physiology and in terms of aid to restore and enhance performance, human performance, as you know, who is my primary interest as a doc in terms of recovery as well. So I thought I had my time as well of arrogance and ignorance when I heard it was exactly 2 years ago when the COVID launched. We were asked to shut down our clinics in BC, in British Columbia. At that time, I was in Vancouver, and shutting down, probably due to the change of rhythm, I was on the edge for a long time, passionate by my work, but burning the candles by all ends. I crashed. Within 3 weeks, I crashed, fell on my knees unexplainably, and I found myself in a position of the typical patient I have been working and helping for about 3.5 decades, which is completely incapacitated, blanked out, disconnected with environments, persons, and looking for oneself within. You see, not a good place to be. So the whole year 2020, after starting April, what was the darkest, has been the darkest year of my whole existence. I went through bad times, but that one was super dark. And one of my dear friends, former flight surgeon from the US Air Force, you know her, Marianne Sides, gently say, Philippe, you should have a look at this. Philippe, you should have a look at that. Da-da-da. And I said, yes, I will. Yes, I will. And I didn't, because I didn't think that would be relevant with me. First mistake. Second mistake, I was out of my state. I was unable to use my brain properly. So I was foggy to the extent I couldn't even read more than 1 minute without landing into strong headaches and fantastic exhaustion spells. So to make a long story short, it took basically a year, and end of January, mid-February, I felt I was plummeting down. No way out. And everything I was trying, which I knew in the past would work, well, this time didn't work. And to the contrary, most of those things, including homeopathy, etc., which I know well as a professional, was worsening me unexplainably. So I was at the end of the rope, obviously. And I began to drag myself in front of my computer and dwell and watch those videos, which have been patiently put at my disposal by Marianne. And guess what? When I found the science, I found the long thread of Nobel Prizes, which beats all records in terms of reward for this discipline in life sciences, which has no equal. 6 Nobel Prizes within just over a decade, never seen everywhere in any discipline, any scientific or literary world. So that drew my attention, because I am an historian by passion, by test, and history for me explains everything. You know, it's the cycle of life, the cycle of generations, etc. So I said, wow, that's, if so many people of that grade paid attention to these details, I better move myself in the right direction here. And I went into the science, and what conquered me, like Carmen and Maureen mentioned, that was the people. Verdis, vision, and heart. And Tyler, walking in his steps, totally groomed on the right values and with his own professional set of skills and personal set of skills. Those two people conquered my heart. And I say, if those people are in with this, it's got to be something, and I better learn something. So I jumped on a bandwagon, signed up on March 28th at 2100 local mountain time here, dove in a swimming pool. And when I received the shipment a few days ago, sorry, I take some details here because you will see how terrified I was when I got the shipment, because everything, remember, sunk me. Whatever I was doing was bad, including food, water, etc. My body was at the end, or functionality, as we say. So I began with a quarter of a cup, which is half an ounce. The first 2 days, I was in a state of controlled panic, waiting for the tsunami to come back with a vengeance. And what? No, nothing. Day 4, same regimen, I felt a little flame. You know this pilot flame in your gas fireplace? Ding, back up, back on, you know. I was out. It made me realize I no longer had a pilot flame in. It was gone. And within a week, I was able to go up to 2 ounces because at day 3 and 4, when I saw I passed the critical, risk of shock, we understand what it means. So sometimes it takes a delayed fashion. It can be up to 72 hours. I passed that step. I say, okay, I think that is worth the try. I'm still alive. Let's do it. And I doubled systematically until I went to 2 cups. And then I spread that gradually as well, from 2 times a day to 4 times a day. And within 10 days, I had an energy that was far better than before the last year event where I crashed, the state I was in. So I want to make a long story short here. Now I am over 90%, still few things, but I had a very severe allergic asthma. I share that very gladly because it's such a common issue. Polyallergy, severe, horse killed me. They sent me twice to the ER in distress, cardiorespiratory distress, etc. Serious business. Cats, I love them. They love me, but they make me sick like a dog. Cats make me sick like a dog. And in other words, respiratorily, I was very vulnerable. And that disappeared. So, and disappeared within 6 months. So I've always been okay shape-wise. I am an aviator, so I chose aviation because I knew that airplane didn't have air. I could be allergic to, so that was great. But, it has been conditioning my choices through my lifetime. And this is a revelation. And, like Saul on the way to Damas, I heard God's voice and he threw me off the horse. I got back on my feet and I learned the lesson. So I'm here to share it now. Thank you.
Thank you, Philippe. That was that's a great story, and thank goodness that it worked so well for you. I will put in our usual disclaimer here, even though it sure sounds like this is something that treats and cures. SIA is not meant to cure, treat, or diagnose any particular condition. Although when we doctors start talking about things, we love to talk about that sort of thing. But what it does is give your body a tool that it can use very effectively to manage many of those. Rich, I'd like to switch over to you because I know you've got a great story about how you learned about this, mostly because of a experience with your grandkids, I think it was, that sort of made you pay attention to this when you may not otherwise have done so. What was that all about? Maybe we can hear your story.
Sure. 4.5 years ago, again, as I articulated earlier, real busy doc. We had celebrated Christmas. 2 days later, I'm getting ready to see my very first patient in the morning, and I get a call from my daughter, and she starts talking about Gideon. At the time, he was 13 years of age. And she gives me 2 or 3 sentences. And as a doc, sometimes we're trained, to be able to tell after 2 or 3 sentences of history history is so much of what we do. And in those 2 or 3 sentences, I told her immediately, I said, number one, get him in the car, take him to the pediatric emergency room right now. Do not wait for the ambulance to try to find you, because they live out in the sticks. It's a lot easier for them to get somewhere than for the ambulance. So she did that. And he was evaluated, transferred to my alma mater, Duke, within about 3 hours in the emergency room. And he spent the next 5 weeks as the star patient at a university medical center. And all the docs on this call will know, you do not want to be that patient. You do not want to be that patient. And, I would go up on weekends and they let me participate on rounds, and all the teams would come in, and you know how it is. I mean, we know how that is. Everybody wants to stump the other people because you want to be the one that finds out the zebra is this, and I can help this patient, Well, he was coded twice during that stay at various times, went back in the pediatric ICU, came back out. And basically what I would say is he had severe CNS challenges. Basically a 13-year-old who could not speak. So he had expressive aphasia. He could not swallow. So he was given a feeding tube at age 13, and he would face plant. So you can imagine I'm helping him so he doesn't face plant, getting to the restroom and doing everything else. So, that was difficult. And when he left Duke, they did everything, soil samples, where they live. They expended no lack of expenditure of mental and physical energy trying to help this kid. Okay. So when he left, he went to a pediatric rehab for a couple of weeks, and life was turned upside down for my family. Now, docs on the call, please, you understand, I'm a grandpa. For your grandkids, you do almost anything, right? But the unfortunate thing is I'm also a doc, and I'm supposed to know how to fix things. And I had a double feeling of impotence, from both of those angles. And quite honestly, the best minds didn't have a place. And so ASEA, through a providential series of events, one person telling another person, she was asking for prayer because literally they were spending thousands of dollars on all sorts of supplements, contraptions, devices, anything that would help him, because traditional medicine had nothing. Okay. And a high school friend saw her plea on social media, said, my mom has a brain thing. It's not the same as your kid, but they're brain things, aren't they? Yeah. And she's trying this liquid, and you should try this. So eventually, and it did stay in their pantry for, I found out, a month or two before they started giving it to Gideon. Within 4 weeks, because she homeschools these kids, she knew there were major changes going on. And honestly, we were going to a birthday party, and you have to understand, she is now pregnant with number 8. This was a adopted kid. They have 3 adopted. It's a big family. You will always have a birthday at any given time of the year. And, it was before Labor Day, and we were going to celebrate 2 or 3 kids' birthdays, a clump of them. And I remember Anna saying, hey, Dad, Gideon is, he's really improving. And I said, wow, that's great. Would you mind hearing about what he's doing? And I said, are you kidding? I wouldn't mind. I'm curious to see what's going on. So we went to this birthday party, and there were some people there that knew about redox signaling. And one of them came in on a Zoom called Dr. Dick Walker. And they knew they had to bring out a big gun to convince me. And I've already told you where I was coming from. But folks, an N of 1 is always a difficult study of any kind to believe. But when it's your grandson and you know the details, your heart just is different. And I was open. Now, when Dick said redox signaling molecules, I'm done. Like, nobody asked me in this room, what does that mean, Pops? What does that mean, Dad? Because really, it was, I've already explained why I didn't know anything about it, really. But the next 3 to 4 months, I bought hundreds of dollars of textbooks. Everybody on the call, they charge us a lot of money for our textbooks. But I went back and I bought them because I wanted to learn. I wanted to learn about redox biochemistry. I wanted to learn about all this stuff because really I had an inquisitive mind. And honestly, the trip has been worth it. Fast forward, I just got a message from them today. He just turned 18 yesterday. I took him to a hockey game last week, and he was running in a road race in Raleigh, which is a big city. He and his brother, and he came in second in his division. Unfortunately, he turned 18, so he's now in the 18 and something division. But he came in second. The only person that, and his brother came in first, and they're SIA users. But here's this kid that 4.5 years ago was face planting. And now he's second in his division running a road race. So, full circle. Listen, the biochemistry is there. Incredible studies. I would ask every colleague on this. Most of if you're into pharmaceutical treatment, we know we have one-ups. I have a product A that's for entity B, and it doesn't do a whole lot for other stuff. It's one-ups. This is because this gets at cellular health, which is so incredibly profound. It's like a Swiss Army knife. I mean, honestly, and it's already been said on the call, there's no toxicity, there's no drug-drug interactions. When I can hit the easy button for a patient, that's a win. When we have complex therapeutic interventions, eyes can start to gloss over. And honestly, every doc on this call, we realize simplicity beats it. For compliance, it beats it if we can be simple. And honestly, this is just an amazing thing that gets to cellular health. And, so I'm excited to have this tool set, incredibly versatile tool, in my tool set now. It is absolutely wonderful. But, it took a personal N of 1 to get my eyes focused. And now I love just going to PubMed and going redox biochemistry and being a family doc still, it's wide open, even for subspecialists. Just plug in your area of interest and just look at all the science coming out now. It's absolutely crazy, amazing, and wonderful.
That's an amazing story.
Yeah. One more thought. I think what helped me is that, calcification happens as we get older. It's part of the aging process, but we shouldn't be calcified in our thinking. Okay. I'm just challenging all the docs listening that may listen to this. Everybody, what we learned in medical school and residency, post-grad is important stuff, but that's where the science was then. And unless you just got out 2 or 3 years ago, don't be satisfied with I know what it was like back then. Don't be calcified, be open. And, I think that would be something good for all of us.
Yeah, that's an amazing story. In fact, it was a similar amazing story that really got my attention early on. It was a young man who had been in an auto accident, and the medical profession had given up on him. He was in basically a nursing home for the rest of his life, 24-hour care. And fortunately, he had a mom who wasn't going to put up with that, so she brought him home. And in their search, they stumbled on a SIA. And that young man just got accepted into a PhD physical therapy program. Amazing stuff. So some of us who have been around for a while came in, there wasn't much science. Now there's a lot of science. Who would like to comment on, for the docs involved, the importance of using, for instance, PubMed or Google Scholar, whichever you prefer. I'm a PubMed fan, for really looking into what this can do. And what I recommend, if you're new at this and you're not sure how important redox is to a certain problem, is go to PubMed, put the problem in, and then put a dash or a comma, and then put redox signaling or redox biology or redox science, because almost invariably you're going to come up with a whole bunch of information, a whole lot of abstracts that have to do with the role of redox biology in that part of the body and in that particular condition. And it doesn't take too much of a leap to say, oh, it looks like these molecules are crucial in that condition, and oh, we can actually supply those to the body just in case that person's body doesn't have enough of them. And, I've done enough of those searches now that my modus operandi is that if I've got a complex patient, and I don't practice medicine anymore, I retired, I'm a full-time redox specialist educator like Maureen. But if I had a complex patient, the first thing I would do is make sure that they were in redox balance. And the only way you can make sure of that is to supplement with ASEA redox. And then if there were some remaining problems after that was in their system, then start tinkering around the edges, maybe with some pharmaceuticals if necessary. But what you're going to find is you're going to find some amazing things happening. And everybody in that situation really deserves a trial of redox, I think, to see what's going to happen when you give that body a tool that it knows full well what to do with. And without that tool, you and your patient are both going to be really frustrated as you try one thing after another that's not working. But maybe a comment from some of the rest of you, how valuable do you find PubMed and all the new science that's out there? And I think Philippe is chomping at the bit to give us an answer there.
Thank you, Dr. Dick. Yes, numbers are never lie. I would like to bring a couple of them on the table just to give an idea to our audience. About over 10 years back, there were up to 600 publications talking about redox as the phenomenon we begin now to know much, much better. That is only over a decade. Now, if you click on PubMed, you have nearing 40,000 rising publications on a topic. And if you go to Google Scholar, you read near 4 million publications. So you see the numbers are rising. It's all over the place. It's worldwide. You have to know that all the biological research societies, scientific societies worldwide shift their name from antioxidant societies to redox societies. There's a good reason, because terminology is everything, and identification of the type of research now that is going on is key. And we evolve. It is the faster growing, scientific domain of research in the life sciences worldwide. So it is there. The science is there. That was my 2 cents, another number.
So let's switch gears a little bit here. We've been talking about the science of redox, and I'm sure that if you're new to this and you know anything about the science, you may be saying, yeah, the science of redox is phenomenal. It's foundational to cellular health. But why would we think necessarily that drinking some of these things would make a difference? So I'd like to kind of switch and have you guys just comment on, guys and gals, I should say, persons, just comment on some of the research that has been done to validate. Quite frankly, ASEA has done a number of studies. They've all been done by third party, but and I think most of the time they were just trying to find out what would happen if we gave people this supplement, see what would happen. But it's also really shed a lot of light on the mechanism of action of this product and what it does when you take it. I think we all have our favorite studies. If you're an athlete, you probably love the athletic study, the metabolomic study. That's one of my favorite. But you know, which one of those studies has really furthered your conviction the most in what we're doing here when we suggest this product to people?
You know, I'll start with the old studies because that's what I had when I first got started. We didn't have the fancy gene study that I'll let one of the newer people talk about. You know, we did have the metabolomics, and that's the one that I looked at when I was deciding whether or not this was something I wanted to try for my family. And, you know, it was a very interesting study because it was basically showing changes in the metabolites that were happening in these healthy athletes that they were doing. And, you know, we didn't have a lot to go on. We didn't really have the mechanism of action, but you could see that it was almost putting the body into almost like a ketotic state. It was glycogen sparing. And it was using fatty acids for fuel so that they were able to run further, faster, longer. So, you know, working kind of in that energy production phase of the body. And it was interesting. I used that to get Joaquin, my husband, started on it. Very shortly thereafter, I told you he's a researcher. He was in April of 2013. He was in Boston at the Experimental Biology Conference there, and he was presenting his research. And he called me. I had not gone with him. He called me. He was like, "You're not going to believe this, but your company has a poster presentation here." And it was the study on mice that David Neiman did, which I thought was so fabulous because when we talk about this, a lot of times people say, "Oh, it's made from salt water." This is a placebo. Well, animals don't know about placebo effect. And his study showed that mice that were given ASEA, given the Redox supplement, could run 29% further to exhaustion than the mice who had not. So mice are not in there to please anybody. You know, it either works or it doesn't. Same with all animals. And I thought that was a very profound study and just spoke volumes. Now, of course, like we said, you know, everybody goes to physicians, especially go to PubMed for validation and verification. But that study really spoke to me. And I was like, you know, there is something here. Didn't know all the specifics, but I thought that was very profound.
Yeah, that study was really interesting because one of the biggest ahas, my understanding anyway, I got a chance to talk to Neiman because I was actually at the conference where that was presented. And he said one of his biggest surprises was they were anticipating or looking for a change in performance between before and after using the product. And the change would occur while they were exercising. And what they found was the change happened before they even exercised. So they were put into their metabolism just by drinking ASEA. We could maybe call that a biohack, sort of. It convinced the cells to go into a fat burning mode, which we would normally do when we exercise after we burn up our glycogen. But here our cells were pre-planning for the exercise, already burning fat. And that was a big surprise to the scientists that were doing that study because they thought they might see something during exercise, but to find that the change happened just by drinking the ASEA was really the amazing thing. Rich, did you have a comment on that?
Yeah, if my recollection of that earlier study is true, it was after 1 week of ingestion that, I mean, you know, it's kind of incredible. And you know, are people going to feel that change in their metabolism? No, generally not. But some people, you know, have incredible changes. You know, the statistics are probably the aha after 1 week is only about 15% are going to respond, who will be responders. So that's really important because, you know, in my world, I still use pharmaceutical agents, and I have to give patients a realistic expectation because I've got to get them to buy into doing this, right? And, you know, if I give them false hope, false expectations, that's not going to be helpful for their adherence to a regimen, whatever the regimen is. So, you know, but that was an incredible study. You know, one thing about the gene study that was mentioned earlier, because I've come in a little later. And I think some incredible things. I mean, genetically, 5 different very, very important genes are upregulated, like woken up, and the dose, if you want to call it a dose, what was given to the in the trial was 8 ounces. And so, I try to be as evidence-based as I possibly can where we have evidence to use. And so I would just submit to a lot of folks that, that was what was given. Knowing what I've learned in my field of preventive medicine now, we know that the gum health is so incredibly important to our heart health, cardiovascular disease. And nobody, I didn't know this when I first started. I would chug the stuff. I mean, I said, I'm going to chug this, But now my exhortation would be savor it like a wine taster would savor it. Hold it in your mouth, swish it around, walk around, think about things, pray, do whatever you want to do. But for a little bit of time, let it savor there, and then go ahead and drop it down. It's been incredibly important for gum health, I think, because this stuff is absorbed right through the buccal mucosa. And folks, blood-brain barrier, no such thing for these redox molecules. So, the genetic study was interesting. It is not a one-time fits all. It's not like, we give antibiotics for a lot of things, acute needs. We get rid of the insult and the person goes on. They don't need ongoing therapeutic intervention. But in this one, in the trial, the way it was designed, after stopping it 8 weeks later, they retested the individuals. They all went back to their baseline, a genetic baseline. So that upregulation is not permanent. It doesn't, you requires ongoing usage of the redox.
And it was 100%.
Oh, sorry.
Go ahead, Carmen.
Oh, I was just going to add the gene study, if there's one that really kind of sealed my belief scientifically in ASEA, it would have been that one. And I believe, if my recollection is correct, average age was 40 years old. They did 8 ounces a day for 2 months. And then they saw upregulation, NRF2, you've got some of the thyroid pathways, you've got the SOD pathway, sex hormone pathways, gut pathways. And this really impressed upon me because in the world of functional integrative medicine, epigenetics is a huge deal, understanding that we are not our gene. Our destiny does not lie in our genes, but rather in the expression thereof. And so we have to grasp that we can affect the upregulation in a good way. And just because some genes are turned on doesn't mean that's a good or a bad, just as if some genes are turned off. Some genes need to be turned off to protect us. That doesn't necessarily mean that that's a bad thing, right? And so showing this upregulation and then understanding the pathways that lie beyond in the methylation and the gut pathways and the biochemistry energy pathways that lie beyond that was remarkable. And I thought to myself, really, salt water, 8 ounces a day, 2 months, we're seeing this already. Number one, who thought to just let's go straight to the genes and look at that? That's a pretty bold thought. And then number two was later I found out the answer to, I wonder if they would have published this if it wasn't necessarily in their favor. And being in the ASEA community, and I've had so many conversations, but I remember hearing once that Dr. Newman was not in he did not believe that there were going to be favorable outcomes with the ASEA approach and with the ASEA studies. And what I remember was he inquired and was like, I'm not expecting to see much. Do you still want me to do this? And the ASEA team was like, yes, 100,000%. Yes, we know what it can do. And so when I found that out, it really even more solidified that these folks believe in it and are trying to, as best as possible, scientifically prove it on the shoulders, as has already been discussed, of the immense information and studies scientifically out there in the redox world.
Yeah, my favorite study is the gene study. I came in early, so I use the metabolomics and athletic studies heavily to get people to pay attention to this. But I think all of us here are very much into prevention, and the fact that drinking this saltwater derived redox signaling product affected those genetic pathways is amazing, because now we're right down to the heart of prevention. We're changing transcription factors, which now change genetic expression. And, my favorite one is the NRF2, which is the transcription factor that tells your cells to produce more antioxidants. Now, how much more protective can you get than being able to address inflammation at the source by limiting oxidative stress? I mean, that's amazing. But there were also a number of other transcription factors in that one gene. Brain-derived neurotrophic factor is another one. When we're talking about injured brains, whether it's trauma or infection or whatever, that BDNF transcription factor becomes very important in recovery. And so the implications coming from that study are amazing. I just hope ASEA follows that up and maybe does some follow-on studies to see what else, and to reconfirm that, because that study has a ton of information with huge implications for where this product and where redox can go, in my opinion, anyway. Any other comments? We're approaching the hour, so I don't want to take too much longer. Maybe just if each of you wants to have a kind of a closing statement, why redox, why, if a medical professional is watching this, why they should do their due diligence and pay attention to this, and not discredit it because it's made from salt water, because it comes from a network marketing company, because it's not a drug, because and you can't write a prescription for it. All of those things withstanding, why should a medical professional take a serious look at this?
I'll go ahead and start. We were very fortunate, my husband and I, when we got involved so many years ago, to have had dinner with Vertus Norton when we were first looking at it. And we were sitting there, like I said, we were skeptical and cynical, kind of arms crossed against our chest and asking really tough questions like, why was this not FDA approved? And he said they probably could have pushed for that, but it would have taken at least 10 years and probably that many more millions of dollars to get that approved. And then it would have had one indication, like our medications do. You would have had to go to your doctor to get it. He said, we know what this is. We know it's 100% non-toxic. It's safe and it's powerful. We're going to bring it to market, and then we're going to let the science catch up with us. And that's really what's happening right now. And the words that he said to me that just sort of disarmed me is, he said, suspend disbelief. Mm-hmm. And what I would say is, if you're looking at this is foundational. This is real science. It's not magic. It's physiology. You can go back. You can look at all the research. You can look at all the studies. We're just helping people get back into balance. And that is foundational to anything else you're going to do for your patients. So be open-minded. Like Dr. Rich said, don't let your brain be calcified. Take a look at this. It may make a real difference for your patients and for the people that you love and care about. So thank you, Dick.
Thank you, Maureen. Anybody else want to, it's going to be hard to top that one, but anybody else want to comment before we shut this down?
Yeah, I would just comment that, we seem to, in this circle, have our N of one. And that really is what has kept me going in the profession of helping others with their greatest thing, which is their life. And it's one thing to live long. We want to live long, but we want to live well, and we want to have a great quality of life. And the health of the cell is the name of the game, period. And I would venture just to say, one of the hardest things about being a physician is to keep up with the up and coming science and the next best thing. And I would also say that it is up to us to also be open-minded, not so open-minded, our brain falls out, but to understand that things that come into our orbit are sent there for a reason. Okay. And if it's not us that's going to take it to this person, it's probably going to be somebody else. And it's your trajectory of where things intersect you in your life and your professional life that then affords the help and care to those that come after that. And so if it's not for you, then who? That sounds cliched, but that's what happened to me and a lot of people here. And so if we really are truly in this to help people, if it only helps one, if you only save one person's life in your career, isn't that enough? Right? Isn't that enough? And so we have to just continue to let it marinate upon us. Let it, if it settles with our soul, then okay, let's go ahead and try this for some people, because just one is all it takes.
Thank you.
Dick, just one other thought. For those on the call who are practicing medicine, we're always looking for adjuncts. Sometimes we do look for that magic one that will cure and help and deal with the medical challenge that our patient is facing. But we also look for adjuncts. I look for all sorts of things that will help me. And for those that were like me, just prescription driven pretty much, don't we use other adjuncts to help lower the doses on those things? Look at how lifestyle could change my approach to somebody with sugar metabolism issues or weight issues, you name it. We use adjuncts all the time to lessen maybe the pharmaceutical usage. And again, I would ask all my colleagues, have that open mind. This is an adjunct. Sometimes it's the total answer, to be honest. Sometimes it's the only answer. But look at this as another tool in your toolkit. Be open to looking at this. This is as Dr. Philippe said, this is cutting edge now. It's becoming cutting edge around the world. And don't be left behind, because this is a tremendous opportunity for you to help your patients.
Philippe, did you have any brief closing comments you'd like to make?
Yes, sir. I am impressed by this whole debate today. It is so exciting and forwarding everything full throttle forward here. So my last word here, my concluding words would be, stay factual. Facts don't lie. Like numbers don't lie. We have the duty of staying informed with the state of the art or the advances in our field. This is otherwise a breach of our own ethics. So let's keep that in mind. We have the duty to inform. We have the duty to stay informed. And there is no blockage, no roadblocks, nothing can stop us in following science. Everything is a fact. I want to come up with a little story, two-liner. FDA took 17 years for FDA in the States, the Food and Drug Administration, to seek a place for these redox molecules because they were so different than what they used to see and test and assess. 17 years and a few millions of dollars from the American taxpayer. Just that. And they failed. They have to create a place, a standalone place for these redox molecule products that are still standing alone in that place. So let's follow the move. Take the wind, go in a breeze. Go with the breeze. Don't blow in a sail on yourself. Let the breeze blow your sail and let go in the right direction.
Thank you.
The study, just a line, the study was about looking for little dose 50, which is to assess any pharmacological products on different types of mice and rats, different ages and genders, you name it, different strains. They all became so athletic, so full of energy, going speeder, faster, getting bigger and not fat. just in harmoniously. And instead of killing half, getting to that dose that would be killing half of the population that would sign up for a pharmacological drug type of action, they failed it 100%. That is facts. So this is totally non-toxic, totally safe, and totally effective. It is so foundational. I won't repeat my colleague's words, but it is so foundational. It can be applied, and it should be used every single where in our medical operations.
Thank you, Philippe. I would just close by saying that if you do start using this product, I don't think you'll ever have to look somebody in the eye and tell them that there's nothing more that they can do, unless you've already had them do a trial of Redox for 90 days or so to see what this will do for them, because for many people, this is the last resort, and for many of those, it works great. But for those of us who have been around it a long time, for many of us, it's now the first product that we recommend, as opposed to writing a prescription for some sort of drug. Try it. I think you'll be profoundly affected by the results that you see for yourself and for your patients. And I just want to thank all of you doctors for spending Saturday morning here to discuss Redox and ASEA and share your expertise with everybody. So thanks a lot. I think if people really like this, we'll come back and do it again. So thanks again.